Okay, I see people are coming in. Welcome. Happy Wednesday, and thank you for joining us today at our 2021 Multicultural Symposium. Today we'll be boldly advocating for equity. I'm going to go ahead and move forward just so we have very limited time. As people are joining in, I'll be going over some logistics and then we can get started on the fun stuff for today. Just to quickly introduce myself, my name is Ragni Lal. Some of you I may know. And okay, so I'm just watching on this screen, I'm watching everyone who's joining in. So today, before we begin, I just want to let everyone know that the event's being recorded. We're on webinar right now, so everyone's on listen only mode and video off mode. That's just how Zoom webinar works. But later on, we will be having more an interactive piece of our session where you will be able to, show your video and then also participate. That'll be fun. We invite you to use the chat box to participate. If you want to use the chat, just to quickly say hi and hello, kind of where you're from. We'll be going over these questions soon on Mentimeter. And then today we're going to have some questions, usually at the end of our presentations, maybe do some Q&A, but we'll be using chat for that. And then we'll be filtering those questions over to the speakers towards the end of the presentation. So I'm going to quickly show you the agenda, and then for the activity session, there will be a new link, and we're going to hop into Zoom meeting. Because in Zoom meeting, you will be able to participate, you'll be able to unmute yourself and share your video and be able to participate, and I think it'll be a fun time. So just make sure you're tracking that link on the chat later on. So just a quick overview for today. We're just doing some intro for 10 minutes, and then I'm going to hand it over to Jesse Cruz, our CEO, who will welcome us for today, and then we'll have Dr. Sergio, who's going to be doing our keynote address. We'll have a little break, and as you'll see, we'll have a couple breaks in between. And then we're going to have a morning workshop with Dr. Tanisha, have a lunch break, and then you can either have a 50-minute lunch break or join us back for a community polling session where we'll just kind of be having some interaction, talking about mental health equity and just asking some of your input on your experiences accessing care with equity. And then we're going to have an afternoon workshop with Jill Lopez Robin from UC Davis. And then we're gonna do, this is where the collective imaging, where we're gonna have a visual activity. This is where I'm gonna be putting in a new link, and hopefully if you're able to join into that meeting, and then we'll do breakout rooms, you'll get to talk to one another and kind of create a little plan for yourself. And then in that meeting, we're gonna have a closing and, end our day for today. So before we get started, I just want to go over community agreements. I'm going to be sharing the slide a couple of times as we go through our community polling and as we have our, and we're going to talk some more about this in our activity session, but you want to be curious, open, and respectful. We want to make sure this is a safe space for everyone. There is a lot of us here, so we want to make sure that we are learning from each other and sharing the space and speak from our experiences. We want to be accepting and be sensitive to diversity, which I hope is something you either learn or know well about for today's theme. And then the learning is, but the names stay, and we take care of ourselves. So if at any point in time, if anything is overwhelming, or if you're just, needing a break, please feel free to take that. And then you have the right to change your mind. So just real quickly, I want to go over some participations on using Mentimeter. We'll be using that for our polling today. We'll also be using some polling in one of our workshops today. For now, I would like to see if everyone's able to use Mentimeter. You can go to www.menti.com. It's right at the top right here, and I think Angela's also going to be putting it into chat. I'm going to see if I could kind of look at chat as well. Thank you, Angela. And the code is 49970408. You can easily open up another tab or use your phone and or smartphone or tablet to participate. I usually use my phone, it's easier. This is just a visual of what it could look like. And then just hopefully everyone's seen the chat and is able to join. For those folks who are participating on Menti, if you could just answer our first question, what county are you joining us from? Oh, looks like people are already here. Amazing. Fresno, Tulare, Monterey, Riverside, Sonoma, welcome. Looks like we have a pretty broad area of California right now. Monterey, Ventura. I'm also seeing on chat, which is totally fine. You can also participate on chat. Riverside, LA, Marine, Alameda, Amador. Okay, we have a pretty broad coverage of California. Thank you for representing your county. San Bernardino, Sacramento. Okay. All right. Again, just for time purposes, we're just going to move to the next question. I have a couple for y'all. San Diego, LA, welcome. So this one is identify your role. You can hopefully maybe identify with multiple, or you can just type them into chat. If you're a family member, a parent, caregiver, peer, if you're from a community-based organization or a county representative, maybe you're a mental health professional or a clinical provider, student, NAMI affiliate. I hope to see a lot of the NAMI affiliate folks today. Hello from NAMI Urban LA, Fresno, hello. Awesome. Thank you all for participating. I know I'm moving quite fast. I just want to get to the fun stuff. So I understand if everyone's having a hard time typing in, catching up, trying to get into Menti. That's totally fine. We'll have a lot more chances to participate throughout the day today. Okay. Awesome. And then this is just something, again, I know it's like kind of a long, this could easily be responded as a long way, but shortly, if you can think about what your community sees mental health as we think about diversity and inclusivity today, we usually think about how it relates to our community, our own culture. So if you could respond to that real quick, it could be a short answer. Thanks, Ali. I really hope that we do bring on some fun stuff today, although I'm not going to be really doing that. That's going to be all of our amazing speakers. Scary. My community sees mental health scary. Yeah. Priority health issue, essential, broad. Okay. Privilege, something not to talk about. Yeah, stigmatizing. Needed, a problem, expected to always be good. So it's a unifying concept affecting families, peers, business, government that has complex problems and not enough practical solutions. Nice. Now response to our actual needs. Overall community sees a nuisance and not the problem. The county does great work around it. I'm glad. A blemish, difficult to find, and priority health issues that require collaboration to support. Something not to talk about, yeah. So I'm seeing a very variety of issues and disparities that we face as a community, and then also a lot of the stigma that we've also faced. City seems to have no idea how to have police not involved. That's actually a really huge topic this year, yeah. Love these responses, me too. All right, I'm gonna add one last question. So I know I went over the agenda super quick today, and then I right after I'm done talking, I can actually put in the picture of the agenda into our chat, so y'all can take a look of what to expect today. But this question is a lot more broad than just the symposium. If you want to answer for the symposium, what are you looking forward to today? Are you looking forward to a specific speaker, or are you looking forward to, like for me, I'm really looking forward to sleep and also for how amazing the symposium is going to be today. So it could be a personal response or encouragement, collaboration, fresh ideas, what affiliates can do to help. Looking forward to help. Great. Change. Yes. Collaboration. So what I like about this word cloud is the bigger the word, the more people have typed in that word or is responded with the word. And it looks like collaboration is one of them. mental health education, support, innovation, inspiration, new pathways, action items. That's something we'll definitely go into today. Ideas and inspiration. Okay. Well, thank you all for responding. I'm gonna go ahead and hand it over to Jessica Cruz, and uh, hopefully we can hear more from you in a little bit.
Good morning, everyone. Thank you so much, Ragini. I'm Jessica Cruz. I am the CEO of NAMI California. I've been in this role for almost 11 years now. So I have had the wonderful opportunity to work with many of you who are currently participating in today's event, and have been able to be mentored by Dr. Aguilar Gaxiola, who you will be hearing from very soon. I am so excited for this year's event. It's the 8th annual Multicultural Symposium. And Dr. Aguilar Gaxiola is basically was the founder of this event. He was our board president, and we really wanted to focus on the diverse communities and what was NAMI doing, not only at the state level, but in the local communities, to make sure that we're engaging different communities and bringing them into the NAMI fold. And we learned a lot. The first few years were really about listening and hearing from the communities of what does mental health mean, right? And to those communities, and how can NAMI help? We learned that NAMI needed to really listen and open our arms and our doors and really meet the communities where they were at. We have come so far in the last 8 years, just with this symposium. And many of you, actually, I was looking at the participant list, have been participating in this event for the full 8 years. So thank you so much for continuing to come back and for continuing to raise your voice to make sure that we are doing the best we can, because we believe at NAMI that nobody should be closed out and that everybody needs NAMI in some way or another in their journey. So on behalf of our board, our current board and our past boards, welcome to our 8th annual symposium. We've had over 1,000 participants just in this event alone. That doesn't include all of the other work that we have been doing over the years, whether there are regional symposiums or our focus groups. NAMI California received a small grant for a few years from the Oversight and Accountability Commission, and we were able to do a lot of great work in doing community reports. But NAMI California has made this its priority for the last 8 years and receives no funding from outside sources to do this work. It is that important to us. And so we're so happy that you're here. I am very excited that Sergio is going to be presenting his work that he has done and his team has done within the Solano County, really to talk about how do we break the walls down of the county work and really reach into the community. He and his team have been doing that for years in Solano, and I am so excited for him to be able to present the results and really help you to learn how to advocate. How do we do this in our own community? How do we take the work that we're doing at the state level and bring it down to the community? And how do we help the communities tell us at the state level what's working? Right? And then we can advocate into the legislature to make sure that what's working in your communities are taken throughout the state. So this is an interactive symposium. Yes, we will be hearing from Sergio and he will be doing a lot of presentations, but the workshops that you're going to be participating in the morning and the afternoons, it's going to be 100% interactive. We want to hear from you. We want to listen, and together, we will have a kind of a roadmap, an actual graphic roadmap. If you join us at the very last workshop, which is going to be at 12:40, we're really going to want to hear from you. What does equity look like to you? And how can we at the state take that so that we can interact with the communities at the local level so that you can really learn how to engage local communities. If you are from a local community, how do you bring people from NAMI into the fold, right? So how do we really collaborate and how do we work together? And this is driven by every one of you here today. So we really hope that you enjoy the presentations and interact. This is an opportunity for you to raise your voice and make sure that your voice is a part of this process as we build this roadmap to boldly advocate for equity throughout California. So thank you again for being here today and for sharing your time and your thoughts with us. I am going to move it on to Sergio. You know, he is a dear friend and a dear mentor. And I have the wonderful opportunity of introducing him. He has just so many accolades, and forgive me as I read through them, I don't want to miss anything because he has done so many incredible things and has done such great work, not only locally at the state level, nationally, but internationally. We were so honored to have him as our board president for over 4 years and a part of our board and really a part of NAMI California building our equity and our diversity work that we have been doing now for almost a decade. He is a clinical internal medicine doctor at the University of California, Davis. He's the founding director, where he currently is at the Reducing Health Disparities at UC Davis, and the director of community engagement programs of the UC Davis Clinical Transitional Science Centers. He has been the chair of so many important committees, and currently he is the co-chair at the National Institute of Health, it's CTSA, forgive me, I don't know what those acronyms are, of Community Engagement, Key Function Committee and Collaboration, Engagement Domain Task Force lead, and the co-chair of the Collaboration and Engagement Enterprise Committee of Health Disparities. He has been part of so many boards, the National Advisory Health Council, National Institute of Mental Health. He's the past board of directors of the Mental Health America, and of course, our past board president. He's a member of the National Advisory Council of Substance Abuse and Mental Health Administration, or SAMHSA, the Center for Mental Health Services. He is a board member for the California Healthcare Foundation and the Physicians for Healthy California and the Public Health Institute. And in October of 2020, he was appointed by the California Department of Public Health to really think through the COVID-19 vaccination guidelines, to really figure out how do we prioritize the supplies of available vaccines. And he's a national and international expert on health and mental health, comorbidities, and health inequities on diverse populations. For over 25 years, he has held several World Health Organization and Pan American Health Organization advisory board and consulting appointments, and is the founding member of the executive committee of the World Health Organization's World Mental Health Survey Consortium, and its coordinator for the Latin American, overseeing populations based in Mexico, Colombia, Peru, Argentina, a regional survey for Brazil, and 2 surveys in Medellin, Colombia. I can go on and on and on, but what I want to focus on is Sergio is an incredible human being. He has dedicated his life and his passion to this work. He is a dear friend. I feel so honored to call him family. I am so appreciative of him to share this work with you. He's a very busy man, so for him to really share his time with us today means the world. So please help me give a warm NAMI welcome to Dr. Sergio Aguilar Gaxiola.
Wow, Jessica, I'm delighted to be here. Just to let you know that when Jessica calls, I'm there, because as she said so kindly, we are family, and NAMI California and NAMI in affiliates are you know, I feel like family as well. So it's great to be back. I'm delighted to be invited to share with you some thoughts and and to share some thoughts longitudinally, because I will tell you a little bit, putting in context what what Jessica mentioned about the work, you know, with. Can you see the slides?
Yep.
Let me do it again. So I'm sure that I don't mess up, which sometimes I do. So once again, I'm delighted to be here. And Jessica, it's been one of the pleasures of my life, genuine pleasures, working with you and Stephen and your team. You are phenomenal. And the progress that you have made really touches me, because you are dealing with human lives, you know, that have been deeply touched by mental illness, and their family, not only individuals, but their families and their communities. And, you know, often I hear new things that you are doing, how you are expanding and you know, and growing and you know, continue to touch so many lives. So I'm just delighted to have this opportunity to share some of the thoughts, you know, to something that started, as you said, really, in this case, 7 years ago. You know, it was not in the inaugural Multicultural Symposium, but it started, you know, what I'm about to present to you back in 2015. And a little bit of, you know, sharing on the memory lane. But back in 2015, I had the privilege, truly, as the president of NAMI California Board of Directors, to be the MC for the Multicultural Symposium. And in that one, there was this panel that focused on Solano County, the work that we were starting back then. And we had this panel, as you can see on the slide, of Sally Tran, a fantastic you know, young woman who shared her story. But then we had Leticia de la Cruz Salas, Roan de Guia, who worked with Filipinos. Halsey Simmons, the director at that time, he retired like 1 year after this particular this particular symposium, and Dr. Henrython. But you know, Henry has been you know, presenting in this context of the Multicultural Symposium on some occasions. And my dear friend and colleague, and now Henry is the associate vice chancellor for diversity, equity, and inclusion. Actually, it's health equity, diversity, and inclusion. And he's doing just a fantastic job. And he played a key role on the project that I'm about to share a little bit about. And by the way, before I go any further, I want to recognize the fantastic job that Jill Lopez-Rabin, who is going to be leading a workshop this afternoon, she has done. She played a really key role in the implementation of the plan, focus on health equity, by the way, in Solano County. And she has her fingerprints all over the report that I will be sharing a little bit about that with you. So at that time, questions from the panel was, as a community member looking to start something like the transformation transforming care at the county level, what are the first steps? And then how is what you are doing different than what's been done before? Fast forward 2 years later, this is in 2017, and NAMI, California, through the Multicultural Symposium, having a finger on the pulse of really what matters at that time, the openness, and in my opinion, a so much needed step to become a diverse NAMI, California, and as Jessica mentioned, very well, she very well said that it is a wide door. So anyone from whatever background is accepted and embraced. So at that time, 2017, there was another progress report from Solano County that Tracy Lacey, who became actually the person who was leading this effort, and with so many other colleagues in Solano County, and she's currently the Solano County MHSA coordinator, and does other things as well. And Dr. Thon returned at that time. In this particular symposium, I had an opportunity to reflect on the symposium so far. You know, it was 14, 15, 16, 17, 4 years since the beginning of the symposium. And I decided to share with the audience the importance about the treatment gap. In other words, those who are in need of services, but they haven't had access to care. And also to focus on the future and to look at the importance of health equity. And so this is where we are now. Just to give you a little bit of background, this is the inequities, structural inequities before COVID-19. I'm using the example of Latinos, but the same picture applies to African Americans and other groups as well. This is information coming from SAMHSA. As Jessica mentioned, I'm in their National Advisory Council of the Center for Mental Health Services, and we get this kind of information, you know, in our quarter meetings that we have. So what I want to bring to your attention is what we call treatment gaps. Once again, treatment gaps are those who are in need of services, mental health services or behavioral health services, and who are not receiving care. And I want to bring your attention to this group right here. And what I want to emphasize is that this group, and by the way, these are this is 218 data on Latinos 12 and older, okay? But in this case, it's 18 and older. And these are those who were diagnosed with co-occurring any mental illness like depression and substance use disorders. You know, of all those at the national level that had co-occurring disorders, 93% had no treatment. Of Hispanics had no treatment. You know, how this progressed right before the pandemic in 2019. Well, this is how it looks like, and this is 2019. And I'm sad to say that the disparity or the inequities increase a little bit from 93 to 94%, going in the wrong direction. And the 2020 data is not yet in, but I'm afraid that this problem has been exacerbated, this tremendous challenge. So that brings me to a question of why health inequities matter, why all of us should be interested in health inequities. Well, because one reason is everyone deserves a fair chance to lead a healthy life, as it is embraced by NAMI California, and I know by the affiliates as well, and the counties. And no one should be denied this chance because of who they are, or their socioeconomic opportunities, or other indicators, where they are coming from, if they live in the rural area or urban area. Regardless of their characteristics, no one should be denied the chance of leading a healthy life. So one key question certainly for me, but my team as well, has been if it is possible to advance health equity in historically underserved populations. So this leads me to give you an update about our Solano County project that that really NAMI California provided a space to discuss it and to dream ahead as to what might happen. And I'm so pleased to share with you the latest about this program and answer to the question that I just posed to you. And the name of this project, and this was the name that the various partners, community-based organizations, as well as the county gave it, was interdisciplinary collaboration and cultural transformation model. This is a model, that took us over 5 years to complete, actually more over 6 years. And the county asked us to focus specifically on these 3 populations that were historically underserved: Filipino Americans, Latinos, and LGBTQ. And our project has been anchored in the nationally recognized cultural linguistically appropriate services standards. And as far as we know, this is the first project of its kind that combines the class standards with community engagement. And I hope that if you're not familiar with the class standards, that I will be happy that at the end of this conversation, and especially after Jill Lopez-Rabin gives you more information about it, that you will remember about these really, really important standards that have become widely used, not only in the US, but internationally as well. So this is the data that the Solano County Behavioral Health Division leadership came back in, I think, 2015 and shared with us. They said, look, there are, 2 populations that have been historically underserved. Of those that we have data on, and they were using the penetration rates. And you have the definition of what the penetration rates mean. And this is service utilization, who are receiving services, mental health services in this case. And as you can see here, 4 years, since 2010, all through 2016, Latinos and Asian and Pacific Islanders had the lowest penetration rates. At that time, the county was not collecting data on sexual orientation and gender identity. And it was through this collaboration that we have with them that they started to collect data. And now we have data. They have data also on LGBTQ as well. So this is, the county, when they visited me and my team at 2015, they asked us, would you be interested in working with these 3 populations that we have identified? And we jumped to that opportunity. And they asked us, can you, create a roadmap of how would you like to go about it? And we presented this idea of these 3 phases that you can see on the slide. First one, comprehensive to do a comprehensive cultural needs assessment, especially of those three populations, actually focus on these three populations. Second phase, which was the intervention, and in a minute, I'll tell you more about it. And then the third phase, that has been the implementation of action plans that I'll discuss a little bit with you as well, and also sustainability, which has been for us front and center right from the go. And that I'm very proud to say that Jill Lopez-Rabin took the lead on focusing on sustainability. So these are the project goals. It was the one focus on working with communities to improve community engagement and partnerships, and increase awareness about mental health services and reduce stigma. We also had as a goal to increase the delivery of class-informed care. And also we focus on the quadruple aim. Some of you have heard about the triple aim, but now the Institute for Healthcare Improvement, which were the original developers of the triple aim, have expanded to what is now the quadruple aim. And that is to increase the consumer experience or consumer satisfaction, increase consumer outcomes, and specifically increase access and utilization of services, and then to reduce per capita cost. And the fourth one that was added was to increase the provider experience. And all of this, the ultimate impact is to have improved mental health. This is a busy slide, but I just want to bring to your attention the intervention that, by the way, we have been refining for 12 years, about 11 years before we got, at least 10 years before we got to work with Solano County on this. And we worked previously with organizations at the state level, at the county level, and other organizations, refining a class training curriculum that our center developed with funding from the Office of Minority Health that was given to California back in 2006, an initiative that created, as you can see on the left-hand side, a toolkit curriculum that we call Providing Quality Care with Class. It became a training, and Dr. Thon, to his credit, he spearheaded this project, and he is a master trainer. So the training is very intense, actually, because it's 4 sessions of 4 hours each. And this is what happened in each of those 4 sessions. And then a lot of homework in between. So there is a big commitment for those who participate. And in a minute, I'll tell you a little bit more about that. But the first session was on an overview in health disparities. When we did the intervention, we already had a good sense of what were the needs and the gaps in these 3 communities, because the first phase was to learn about it. We did focus groups, we did community forums, we did key informant interviews, and learned directly from those communities what were their needs and gaps, but also we learn about their strengths and assets. It's very important when doing this work to identify, not just the deficits, but the strengths that people have as well. The third session is about the class standards, and this is where the participants start to create, with a lot of guidance, create action plans or quality improvement plans. And then on the 4th session, they come and present the plans, to the group, and they refine it. And then there is an extra 5 to 8 months of coaching when our team members meet with small groups that come up with these action plans. And we favor in this particular project for those who participated in the trainings, and we had 3 cohorts of about 20 people in each of them, a little less than 20 people. And we asked them to come together as small groups, like 4 people for each of the groups. And this is what happened, you know. They came up with 14 quality improvement action plans. We call them also quality, we call them like that, quality improvement plans. And these are the how we organize it. There are 5 quality improvement plans that are community focused. There are 4 that are community based organization defined. 2 focus on workforce, and 3 focus on training specifically. And the names that you see there, like taking class to schools, ICU, those are the names that those who created these action plans came up with. You know, there were no names pre-assigned, but this was what they decided to call them. So just to illustrate briefly 2 of the action plans or quality improvement plans. This one is taking class to the schools. This has been such a fantastic action plan, you know, and that was, you know, the county has funded so far 45 wellness centers on school campuses, K through 12, and adult education sites. And there are 5 pilot sites open before the school closures due to COVID. And there are many more that are being planned. This really has been very successful and has received quite a bit of funding. It has called the attention of the legislators, especially, I'm proud to say, of Senator Bill, who has been such a great supporter of NAMI California, who was the lead of the mental health caucus at the Senate here in California. And so this is, I'm very excited about this particular action plan that has a lot of promise and you know, and is focused on youth, which is of critical importance right now under the impact of COVID. This is another, just to give you a sense, this was focused on training, and I'm proud to say that Jill is the one who provided the training. And this is a training for the frontline reception staff, because there is data. You know, I have been saying for years that it is very difficult for some populations to get into the doors of service. But once they get there, you know, there is a high proportion in some groups that don't return for a second time. You know, I know data with Latinos that those who finally make it into services, that, you know, 50%, even in one study, is even greater than 50%, that don't return for a second time. And the question, of course, is what happened the first time? And we know that it is how they feel, you know, embraced or not embraced, welcome or not welcome into the reception, as simple as that. So this one, it was so aptly named ICU, because that was the idea. It was to train the frontline reception staff to see and to engage and to embrace those who were coming for services. So, you know, I have been doing this kind of work for decades, actually. I'm delighted that Christina Alejo Garcia, who is in the audience, and sent me a chat message. So great to see you, Christina. We worked together for over 15 years in Fresno County. And, you know, just to use it as another example, that in these longitudinal projects, there is always something that happens. You know, in Fresno, when we conducted a very large study that Christina was very much involved with, and this was funded by the National Institute of Mental Health, the largest study that has been done of people of Mexican origin, you know, very comprehensive mental health survey that, you know, it was 189 at that time. And it scared a lot of people at that time. And we had to deal with that going to the media to try to diminish the negative impact in the study that we were doing and in the population, quite frankly. So there were some unanticipated impacts that are important for you to keep in mind. One is the immigration concerns that happened in 2007. Many of you are familiar about the public charge, which really scared people for not using public health services. It really had a negative impact in some population, especially the immigrants, in particular, the Latino community members, once again, in accessing services. The other one is an attempted rollback of don't ask, don't tell, and same-sex marriage. The other one is the racial unrest with the, you know, that was triggered by the murder of George Floyd in Minneapolis. And now we have seen, you know, the hate crimes that are targeting the Asian and Pacific Islanders communities, and that has led to increased fear, anxiety, and depression. But the big one that we're still experiencing is, you know, the COVID-19, the impact that it had in 2020, and certainly during this year as well. And some of the things that happened is that the county needed to transition to telehealth services and instead of in-person services. And that impacted also the implementations of several of the quality improvement plans. Some trainings had to be canceled. The virtual community meetings became, you know, and continue to be to a great extent, you know, being done as opposed to in-person meetings. There were some hiring freeze, you know, the pipeline that was created, that was, you know, being implemented as part of another action plan had to be stopped. But this is the data. This is coming to the data. So to start answering the question that I told you, if it is possible to advance health equity in historically underserved populations. And you remember the baseline that I show you. So move forward or fast forward to 2016. This project officially started in January of 2016. And this is what has happened since then. You know, that Asian and Pacific Islanders, as you can see, there was an increased service utilization, which appeared to be modest, but it is enough to have an impact at the population level. And for example, the consumers served increased from 16.9% for Latinos and increased 7.9% for Asians. And this is another piece of information that I want to happily share with you, that the increase on calls to access lines requesting services in the case of Filipinos here increased by 1.5 times, you know, to the previous years. This is pre-intervention. And also the same with Latinos, 1.5 increase. But look at this. For those who identify as a gender other than male or female, increased 5 times. And those who identified their sexual orientation as something other than heterosexual, increased 7 times. That is the county, you know, our county colleagues are very happy to see that increase because of the need. Another of the many outcomes that we included in a recent report that we released is something that we were hoping to see, the county was hoping to see, and that was to decrease in first admissions through the crisis services. And sure enough, what we reported, and this is at the population level, for example, by the way, this is countywide, that Filipinos reduced entrance into services, not through crisis services. There was a reduction of 15%. In Latinos, it was 8%, and LGBTQ, it was 8%. So that means that more people are entering the system through outpatient services, which is less expensive and leads to more sustained outcomes as well. And just to focus a little bit on youth and families, this is a change in positive perceptions of behavioral health services, and this is general satisfaction of services. And I grant to the county that the satisfaction with their services was already high, but look, throughout this project, the implementation of project, it increased by 1% according to youth that were asked, and increased 2% in families. It doesn't look like too much of an increase, but you have to consider that the ceiling was already very high, and that this is at the population level, it's at the county level. This is a change in positive perceptions of behavioral health services. In the case of youth, there was no change, but there was not a decrease either. But in the families, it was also an increase. And this is change in positive perceptions of behavioral health services between youth and families, an increase, a modest increase in responsiveness of services for youth, and a little bit larger increase according to the families. So just to wrap up, to the question, is it possible to advance health equity in historically underserved populations? Yes, it is. I'm happy to report to you that mental health equity can be advanced through community-based approaches, like the community-based approach that we use in Solano County. And just to finalize, this is the report that we just released. This is how it looks like if you can look at it. This is the printed version. But I asked Ragini if she could share with all of you the PDF of this report. And you see at the bottom of the slide where you can download it as well. And also, this was a surprise to me that the report is also available like a Flipchart, which is a very cool thing. I didn't know that this thing existed, but it is just a joy to see that you can flip the books at your own pace in this website as well. Thank you to the vendor that we use that created this incredible report, full of infographics and colorful, but more than anything, meaningful in how the data was presented. So I'm going to stop here. I want to recognize the role that Maria Alanis, who was the co-project manager all along, and also Jill Lopez-Rabin, who also is the co-project manager, and as I mentioned to you, played a key role on the sustainability. And this afternoon, she's going to focus more into this this particular topic. And with that, I'm going to stop. Sorry if I spoke too much, but I'm very excited to really share this information, because I had been working on the health equity, mental health equity field for decades, truly. And it's not common that you see systematic work, longitudinal work that has been done for so many years that we can share the specific outcomes that indicate that it is possible to advance health equity in historically underserved populations. And I'm going to stop here. Jessica, I don't know if there is a little bit of a chance to some questions, or please guide me as to how you want to finish with this.
I will throw that over to Ragini and Angela. I think they're the ones handling all the logistics. Thank you so much, Sergio.
Oh, my pleasure, genuine pleasure.
Thank you so much, Sergio. It's been amazing hearing about the report. I know the last couple of years we did our trainings and the cultural competency trainings, and it was amazing to see the progress of your project, the Solano project. It's been such a success, and it's just so wonderful to hear about the outcomes, and I can't wait to dive deeper into the report after the conference. So yeah, we do have about 5 more minutes before we go into a short break, but we have 5 minutes. So if anyone does have any questions regarding anything that Sergio just spoke about and his experience in working on the project and or his thoughts on mental health or in health equity, please go ahead and type in the chat box, and we'll see if we can answer them. And then if not, then we can everyone can go ahead and take an early break as well. So looks like people are saying thank you. So I have.
But if I can say, Ragini, that a lot of this thinking also maturing these ideas and it came as a result of the interactions with NAMI California. Having teams from the Solano County come and present, all of those things are so helpful because, sharing with, an incredible audience that has brought together by NAMI California through the Multicultural Symposium. So you have credit, absolutely. I give credit to this as well, to Jessica, Stephen, and Ragini has been wonderful to do the trainings together as well. And Angela and the fantastic team that you have at NAMI California.
Thank you, Sergio. It's just amazing to hear that, I haven't been directly involved in the project, but that NAMI has been involved in such a successful outcome. And I think, Jessica, I don't want to speak for her, but probably agrees. And as Jessica said, you've been with us for so long and really, really grateful for your support. I do have a question, but I also said Jessica, turn on her video real quick. So, did you have anything to say, Jess? Oh, okay, cool. So there's a question where it says, the anonymous person mentioned that they apologize if they missed it, but the class curriculum, is it available or is the program ongoing?
It is available, actually. We have a version of the class-based curriculum in our website at this UC Davis Center for Reducing Health Disparities. The state also has a version, the 1.0, but now we are kind of 3.0 because it's constantly evolving as things have evolved as well. For example, the class standards were developed by the Office of Minority Health back in 2000. And the original standards were 14. And by 2012, they became 15. And Jill is going to share a little bit more specific information about that later on. But yeah, this is to share. We are delighted to have an opportunity to share, what is the learnings that we have had, Ragini. And I thank for that question.
Thank you. Another question I saw is, Do you think this program can be adapted to address the mental health treatment gap for the massive and historically underserved prison population in California? And if so, how?
Yeah, absolutely. Something that I didn't have a chance to present is that this has been funded through prevention and early intervention and funding approved by the Mental Health Services Oversight and Accountability Commission. It's funding that goes to the counties, and the county is the one who funded this project, but the money comes from MHSA, okay? And the Oversight and Accountability Commission has been working with us and the county to create what we call a learning collaborative to provide trainings, not at the same level of depth that we did in Solano County, but to train the counties that are interested in this. And so far, the last I heard, there are 27 counties, including LA and Alameda and Orange County, who are interested in participating in this learning collaborative. So the answer is yes, it can be adapted anywhere, because it's based on what people learn during the first phase, which is to really have a finger on the pulse of what matters when it comes to treatment gaps and concerns for the populations of focus. Yeah, it can be adapted and tailored.
Thank you. Thank you. I feel like that's one of the main things and the reasons why I think this project is so amazing is because it is able to be modeled and used for other populations, other underserved communities besides racial communities as well. So I think that's pretty incredible.
Yeah.
And looks like I'm not seeing any more questions, but Sergio, are you comfortable with sharing your any type of contact information or your assistant's contact information if anyone does have questions?
Absolutely, yeah. And Jill is going to also share her own information. And if any one of you would like to have copies of the community narratives, as we call them, of the focus groups and key informant interviews and community forums that we conducted, there are three for the three populations of focus. And we have the translations into Spanish and Tagalog, okay, for those three community narratives. So that is available. There is a bunch of reports that we created, and I credit Jill and Maria and a whole team. There was a lot of people involved with this. I can tell you that I'm here speaking on behalf of the team, but I'm only just one of this team collaboration that we have. Yes, yeah, we can share some other things that may be helpful.
That'd be amazing. Definitely. Looks like Jill is sharing some of the reports that you're talking about in the chat. So thank you, Jill, so much for that. And thank you, Sergio. I really appreciate, again, like Jessica said it already, like amazingly that, you're such a busy person and you still took the time for us and, we consider your family and we really, really appreciate your time with us.
Well, let me tell you, for me, it's golden to be able to be with you. As I said, NAMI, California, NAMI affiliates, and NAMI in general is like family to me. It is so much imprinted in my heart, truly, and especially it melts my heart the populations that you're serving.
Thank you so much. All right, well, looks like that is all for our keynote address. Thank you, Sergio.
Thank you.
And I will go ahead and let everyone kind of go on break. I know I mentioned we had break a little bit before. We have about 2 minutes left before we start into our next session at 10:10. So just quickly, as I'm talking, go ahead and use your computer, grab some drinks, and relax and take your time to just kind of do some self-care throughout the day as you're listening to us, chat at your way today. So soon we're going to have Dr. Tanisha Freeman Foster for a morning workshop presenting I Dream of Equity, the Power of Our Thoughts and Actions. So I'll see y'all in a couple minutes. All right, I know that was a very short break. There's always so much to learn from Dr. Sergio, so I understand why we always have a lot of questions, and the Solano project has been amazing. And for our afternoon workshop, Jill Lopez Robin will be actually going more into developing the action plan based off the Solano project that Dr. Sergio was talking about. So, but I do want to hand it over to Dr. Tanisha and not take up more of her time. So yeah, definitely. I just want to welcome everyone to our morning workshop. And I'm going to go ahead and hand it over to Dr. Tanisha Freeman Foster to go ahead and introduce herself and kind of talk about the power of our thoughts and actions.
Awesome. Thank you, Ragini. Thank you so much for the opportunity to be in attendance at this event today and to also facilitate this presentation. Right, so I dream of equity. The power of our thoughts and actions is our topic today. My name is Dr. Tanisha Freeman Foster. I serve as the project director and change consultant at Change Matrix. And in that organization, I oversee services for the National Technical Assistance Center for Child, Youth, and Family Mental Health, also known as NTAC, and also Mental Health Transfer Technology Center Network, known as MHTTC for Region 9 Pacific Southwest. My background includes community health, organizational management and leadership, and also organizational leadership, my doctorate degree. I am certified as a diversity professional, certified health education specialist, courageous conversation about race certified practitioner, and also a certified project management professional and transformation coach. And my background includes mental health, substance use, child welfare, and HIV and AIDS. And I am extremely passionate and concerned and committed to working with programs and individuals and organizations and creating equity and helping them foster equity for individuals, because we know that is one of the ways that individuals who depend on us for services will receive the best outcomes possible. So getting to know you, please share in the chat. I think you shared earlier your location, so we'll skip that, but please share your name and the meaning or significance of your name in the chat. All right, I see some starting to come in, some name. Lucky, and please forgive me if I pronounce your name incorrectly. Someone my mother admired in high school, someone says his mother's middle name, Hebrew House of the Poor or dates, nickname after a grandfather and father. Thank you very much, and you can continue to put those in the chat. Thank you for sharing that. Named after a father, Stephen. South Africa that produced the beer, diamonds. Awesome, thank you so much. You can continue to share those in the chat. So one of the reasons I asked you to share that is because a lot of times a name is the first ability that we have to engage with the individuals that we serve. A part of getting someone's name right, spelling someone's name right is critical. And sometimes that's the thing that we overlook. And a lot of times it even happens in email. And in email, all we have to use is our first finger to scroll up a lot of times and look at the signature for that individual who sent that email. In person, we can ask that individual how to pronounce their name, and we can spell it phonetically in their file or make sure that we practice it before they come in. But a lot of times that is the first engagement, and coming and presenting someone's name wrong and doing it several times over and over again tends to be something that distracts people from our services because we say it means that we don't care. So this is a name tag and it says, hello, my name is powerful, valuable, uncompromisable. It's the bloodline to my ancestors and the roots of my identity. And so I just want to make sure that we remember that equity starts at hello, that we have to get people's name right. We have to be sure that we're spelling it correctly. And if we don't know, just ask. Most of the time people will be willing to share. Just as I asked you, what is your name and what is the meaning or significance of your name? You were happy to share that because it's rooted in something that means something to you. It's valuable to you. And so we have to remember that same thing when we're working with other individuals. So our learning objectives today are that we're going to learn and understand the immense impacts of inequity. We're going to identify the ways in which our biases and beliefs impact our actions. We're going to identify strategies for checking our thoughts when making important decisions and explore actions that foster positive changes and equitable outcomes for diverse populations. So anytime we do a presentation like this, we always want to ground ourselves in the fact that language is powerful. When we were younger, we used to hear sticks and stones may break my bones, but words will never hurt me. Now we know that is exactly the opposite, that sometimes the sticks and stones are less hurtful than words, and that words do have an impact. And sometimes we carry the impact of those words for our entire lives, and it impacts how we think of ourselves, how we think of diagnoses that we may have received, how we think of our ability to survive when life gets hard. And so we want to make sure that we ground ourselves in being affirming and respectful, that we use strength-based and hopeful language that is an inclusive and accepting of diverse cultures, genders, and perspectives, and that we keep in mind that we are all on our own journeys, and we're coming in this for the primarily the same goal, that we want to be our best selves, and we want to make sure that the individuals that we're working with are able to be their best selves too. And that no matter where we are on this journey, whether we're a beginner or whether we are an expert, we have the ability to grow and learn and share with each other. So in creating some shared definitions, there are many definitions for equity. And so this is a slide that I'd like to use just to ground us in what equity is, and also acknowledge that there are other parts, that equity by itself, it helps, but we need other things to help move the needle forward even further. And so equity is a portion of the conversation, but we also have to keep in mind the importance of inclusion, the importance of belonging, and the importance of diversity. And so in this model, equity is constantly and consistently recognizing and redistributing power. Diversity is multiple identities represented in an organization. And inclusion is the thoughts, ideas, and perspectives of all individuals matter. And belonging is where we can bring all these things together, and we meet in the middle, and we create a culture and an organization that engages the full potential of each individual within the organization. And we are able to foster innovation where people thrive, where their views, beliefs, and values are integrated into the work and the services that we are providing. And so we just want to keep that in mind as we navigate this, that we are focusing on equity today, but there are also other ingredients in this recipe that are necessary to create the outcomes that we desire. Also, more definitions. If we hear the word BIPOC today, it stands for Black, Indigenous, and People of Color. Health disparity, it's a higher burden of illness, injury, disability, or mortality experienced by one group relative to another group. Versus a healthcare disparity, which is the difference between groups in terms of health insurance, coverage, access to and use of care, and the quality of care that is provided when those individuals access those healthcare entities. When we talk about health equity, we are looking at the state in which everyone has the opportunity to attain their full health potential, and no one is disadvantaged from achieving this potential because of their social position or any other social defined circumstance, such as the location that they live, their zip code, whether they're regardless of their race, their gender, their sexual orientation, their gender identity, regardless of who they are, they receive the same type of care, and they receive the care that is important for them to lead their best lives. So we're going to look at this starting out through a lens of your favorite restaurant. So I want you to take a step back and think about your favorite restaurant. You say favorite restaurant ever. What is your favorite restaurant, and why is it your favorite restaurant? And we can talk about the restaurant in terms of the food, in terms of the culture, of the ambiance. Think about your favorite restaurant and think about why this is your favorite restaurant, and share that in the chat. So I see Applebee's and the chicken salad, and it was the first place that I went with my husband. And so there's some significance connected to a milestone. We have excellent quality of food, service, and atmosphere. We have traditional music, decoration, and of course the food and very welcoming staff at the Thai house. Joy's the Crazy Cajun in New Orleans, the best catfish. I'm gonna mess that up. Atachfela. Garlic crab. So I see food, I see things about the staff, I see things about the environment, such as jazz, welcoming staff. So let's keep these things in mind. So what would make this not be your favorite restaurant anymore? What would make you stop patronizing this restaurant? What would be the deal breaker? Rude service, decrease in the quality of service, apathy of staff, food not appetizing, bad customer service, experiencing racial biases, sometimes very loud customers. So what I would like for us to do is to keep this in mind. Let's think if we can think of our favorite restaurant and what makes us want to be there, and also think of that favorite restaurant and think of the things that would be deal breakers that we would say we are not going to that restaurant anymore, and transform that to your organization. Thinking of your organization, what are the things in the ways that you can engage with individuals from diverse populations and diverse communities, and what are some deal breakers? And thinking of the deal breakers and also looking at those deal breakers as things to think about. Are we doing these things? Are we not engaging with people because of these things that we're doing? And so looking at it through a restaurant is often easier sometimes than looking at it from our organizational view. But if we can think of it in the same terms of what makes us want to go to a restaurant, why is that our favorite, and what would be deal breakers, and look at our organizations through that same lens, sometimes it's easier to navigate ways that we can improve the culture and improve the outcomes. So inequity, and this is one of my favorite things to talk about. So inequity is not a machine and it's not a monster. And sometimes we talk about inequity as this thing. We talk about it as this system. And once we do that, we dehumanize it. And so we want to talk about inequity not being this machine. It's not a monster and it's not a machine and it's not this piece of metal equipment that we can't do anything with. Inequity is an inside job. So we have to look at the humanity of inequity. It's not just the system, it's the people behind the system. It's the people who are writing and creating laws and policies and ways of being, ways that funding is distributed. We have to look at the humanity of it. How do we speak to the humanity of the individuals who are making the decisions? And those individuals create the policies and the systems versus this system being this monster or this thing we can't do anything with. And so why is this important? Why is it important that we look at the humanity around inequity? It's because inequity is making us sick. We know that ethnic and racial minorities often bear a disproportionately higher burden of disease resulting from mental health disorders. And we are all in this field. We know that people don't have to struggle from mental health challenges, that they can live and they can thrive with mental health challenges just as they would with diabetes or HIV or heart disease or any other chronic illness. We know that approximately 50 to 75% of youth in the juvenile justice system meet the criteria for mental health disorder, and most of them are BIPOC youth. And so now we are talking about the criminalization of young people due to their mental health challenges and unaddressed mental health challenges. We also know that there are disparities among LGBTQ, lesbian, gay, bisexual, transgender and queer individuals and questioning individuals who are 2.5 times more likely to experience depression, anxiety, substance misuse when compared with heterosexual individuals. And we can see these disparities. I won't read this slide word for word with you, but we can see these same inequities and disparities occurring among Black men. We can see it occurring among young people who identify as lesbian, gay, and bisexual, individuals who were US born Hispanics, Native and Indigenous American adults, and young people. Also in religion with Muslim Americans. And also we know that racial trauma increases the risk for PTSD diagnosis. So how did we get here? That is the question. And in order to answer it, we have to unpack our suitcases. And I firmly believe that each of us, I call it a suitcase of life, that we were born and we inherited this suitcase. And before we were able to put our own stuff in it, individuals that we loved put things in it for us. And the goal was that it would serve as a point to protect us or to help us be our best selves. But it's also important that we go into that suitcase and we find out what's in there. And is it helpful or is it harmful? And things we know sometimes with racism or with marginalization, that those things could be things that we're profiting from or things that we are insensitive to because we don't feel them in the same way that others do. And so that's why it's important to go into our suitcase to find out what's there, who put it there, and is it still useful for us? Is it aligned with the individual that we are striving to be? Is it helpful for those individuals that we're working with? And if it's not, then we need to remove it and we need to replace it with more positive things, more positive perspectives. And that may mean surrounding ourselves with different people, engaging with within different circles, and really looking at how we show up in this work and how we show up with individuals who we say we care about. So next, I'm going to share a short video with you regarding the impact of our blind spots and biases.
Are you seriously considering her as a candidate?
Just don't trust
She's a woman.
She's a woman.
This is a man's
She's
job.
clearly not educated.
Really not. Does she even speak English?
That's not me. I'm not like that. You call it an honest mistake. Science calls it a blind spot. Our unconscious mind is a mysterious and powerful thing. It makes 90% of our decisions without us even knowing it. Our brains are overloaded with 11 million pieces of information every second. Yet we can only process about 40 of them. So we're wired to make cognitive shortcuts, using past experiences to make assumptions. And you know what happens when we assume. Our unconscious mind can put us on autopilot, determining where we sit, who we eat lunch with, who we turn to for advice, and who we choose to offer a helping hand. Living our lives with blind spots can put us in a tunnel. Same point of view, same decisions, same outcomes. We can find ourselves trapped in the land of snap judgments and misconceptions. We've all been on both the giving and receiving end of blind spots. Think about it. Who's talented? Who's able? Who can I trust? Who belongs? We've all been there. Blind spots are part of the human condition. Our choices have consequences for us and the people we interact with. By accepting that blind spots exist, we can stop. Imagine what possibilities exist if we could do it all over again. Different perspectives, inclusive relationships, diverse networks, better outcomes, seeing people for who they really are. People like you, with unlimited potential. We all have blind spots. Once you accept that you have them, you can choose to do something about it. It's time to check your blind spots and focus on what's possible.
Okay, any thoughts or things that stood out from the video? Anything that resonated with you? Check your blind spots. Awareness is the first step, absolutely. Not blaming, acceptance of self is key. It's very powerful, and definitely not judge. Turning off the autopilot, absolutely. Don't make assumptions. Thank you all so much for sharing. And the reason that we focus on this is because these things are at the root of inequities. And in order for us to be able to, we have to feel the inequity, and we have to understand the different perspectives, and we have to look at the human side of where it's rooted in, how it's okay for these things to exist. And so our goal is to move beyond education and awareness and move to action. And the more we can, education is great and it's important, and it's essential for us to continue to learn. And at the same time, we have to hold ourselves accountable to moving forward, to taking what we learn and to look at ourselves and to look at our organizations and be aware of what's going on and implement strategies and solutions that help to fix it and be a part of the solution, because standing by and watching it happen and not do anything is just as harmful. Becoming aware of our biases and working on them, absolutely. And remembering that this is a no judgment zone, that we are all in a different space, and we all have this luggage, and we have all inherited this luggage, and things have been put in from the individuals that loved us early on, and also throughout our lives, through cultural conditioning from the things that we watch on television or the groups that we are part of on Facebook, or even in our religious institutions. We are making deposits, sometimes consciously, sometimes subconsciously, and that's why it's important to really examine this. It's also important to get to the roots, the why, looking at why we think certain ways about certain people, and asking ourselves questions. In what ways does this emotion serve me? Where did this emotion come from? And am I ready to change it? Also understanding that the roots of the issue may be embedded in privilege, cultural conditioning, prejudice, ignorance. We just don't know any better because we haven't been surrounded by people who are different from us. And it's not an excuse, it's a reason why. And it's also an opportunity to move beyond that and to move forward and do something different and be better. Also, affirmation that the behaviors and inequities and the things that cause inequities are supported by the groups that we're in, that they're unfazed by it, or we're unbothered by it, or the data says that certain groups are not going to come to treatment anyway, or they don't do well, so why focus on those groups? So they may be things that are foreign. We may have familial reinforcements that that's the way we think about people who are different from us at our tables, or that's the way we think about inequities. The people who don't want help are not seeking help because they're lazy. And so those things, those conversations, those circles, the information that we process all come together to form inequities ultimately. We talk about racism and white supremacy, fear, power, overgeneralization. So we may have worked with one client or one individual, and they exhibited a certain type of behavior and had a certain type of outcome. And now we've taken that label and put it across an entire group of people. Those individuals from that community, those individuals of that race, those individuals of that age, those individuals of that gender don't do well in this, do not have good outcomes. And we just double down on it and stick with it. And our beliefs drive our actions. So that's why we are focused on beliefs and really examining ourselves, because those things come out. What we consume, we will contribute. Also, maintaining the status quo is another reason why. This wheel of power and privilege, I found it is very important. We talk about intersectionality a lot, and how people present, and how intersection is a lens in which we move and navigate through different characteristics of our life. And so I am a Black African-American woman. That's just one part of who I am. I live in Florida. That's another part of who I am. I live in a certain neighborhood in Florida. I have a certain religion. I wear a certain type of clothing. I wear my hair a certain way, and all of those different things overlap to create me. And there are subcultures within that. And within those subcultures and within those characteristics, there's either power or there's either marginalization. And so it's important to keep those things in mind. And this chart, I feel, really takes a look at it. So we pick a section within the chart, for example, English. If someone speaks English in the United States, there's power attached to that versus someone who learned English later on or someone who doesn't speak English at all. And so the further you move out from the center, the more chances you have of being marginalized and oppressed and prevented from getting opportunities or discriminated against or even killed because people mismanage your perceptions or you are perceived to be a threat. And so we have to keep those things in mind, or you may not in the workplace be perceived as being as smart. So we look at power again in the center. We look at ability. We have able body. So if you are able to walk and talk and move and think independently, you are in a position of more power, or you have the ability to navigate that with more power versus someone who may have a significant disability, who comes for an interview and people prejudge them and think of all the ways that they may not be able to be successful or effective in that work. And so looking at this wheel of power and looking at skin color and citizenship and housing and body size, and even looking at it in a lens of what does this look like with our clients? When we look at our data, what clients are successful in our services? What clients are not successful? Who's in our leadership within our organization? What are the themes of individuals who are in entry and mid-level positions versus those who are in upper management and C-suite positions? How does this power and privilege wheel look like within the organization, look like within among the staff, look like among your clients? Those are real conversations that have to be had if we are really moving towards the goal of equity. So change, we know that we have to change. If we want better outcomes, we have to do different things. And so where do we go from here? The first thing is meeting people where they are. And so this is an infographic that I created with this individual in the middle and these help buttons, because this is the ultimate goal, that no matter where people are in their life or in their situation, they should be able to access help, whether we are a mental health provider and people come directly to us, or we're working with our local 211 hotline and people are coming to us through that, or they're going to a car dealership and the car dealer sees that they are struggling with life, they should be able to navigate back to that system. This requires us to build ongoing and comprehensive community partnerships in order to create this no wrong door, in order to create a system where people can get help, where you come to drop your child off for daycare or after school program, and I see that you're struggling, and I automatically know that I can refer you to ABC Mental Health Center. Or you're in Walmart, and I see you struggling, and I can help you with food at Walmart, but I know I can't serve your mental health needs, and I can refer you to our local mental health organization. And so this requires us to be intentional and to really wrap around our community members and to really strengthen those community partnerships. Also, we have to look at equity through the lens of the socio-ecological framework. How does equity show up at an individual level, at an interpersonal level, at an organizational level, community level, and public policy? And I've listed some questions that correspond with each section. So the first one at an individual level is, can all individuals see themselves in images of recovery and wellness? So if I, as an African-American female, walked into your office for services, do I see myself? Do I see myself in the lens of recovery? Do I see people who look like me smiling and thriving? It could be on pictures on the wall, it could be brochures. Do I see myself there? Do I see other therapists, other peer support staff who look like me? And that goes the same with other diverse populations as well. If I'm in need of a shelter or a food pantry, Are you able to provide me with those resources that are applicable to my religion or applicable to my culture or my preferences? Or is it, this is the only one we have and either you take it or leave it? Also in interpersonal, what types of opportunities are facilitated by the organization to support family of choice and positive social networks? Do clients have a choice in diverse care providers? How is the organization engaging and retaining staff at all levels? Does the organization maintain the community partnerships necessary to respond to the holistic health needs of diverse populations, clients, families, and staff? So if I'm coming to your organization for mental health services, but I'm in need of a food pantry, are you connected to a food pantry? Are you connected to multiple food pantries that serve the dietary needs of all the individuals that you serve? If I'm in need of a car seat, are you connected to either a fire department or a children's hospital or a children's service that can provide me with the car seat? And so looking at our organizations as, again, that no wrong door, and also a one-stop shop, and also understanding where our expertise starts and where our expertise starts. This is what our organization focuses on, but we know that people have greater needs. And so who in the community do we need to be connected with in order to make this happen? And that may be through a phone call. That may be, I have a client coming on Wednesday at 3 p.m. Can you come to my office at 3 p.m. to meet with me with this client? It may be a virtual meeting or a co-location. If we see that there's a lot of need, maybe it's on Tuesdays that someone from another organization comes into our office or vice versa. Also, in what ways is the organization engaging policy and decision makers? And we know with nonprofit organizations, there is a law against lobbying, but there's not a law against education. And so are you including your local policymakers and your federal and state policymakers on your organization's newsletters? Are you highlighting the needs? Are you highlighting the successes and the challenges that you're having? Are you informing them of this through email, or inviting them to open house, or inviting them to a lunch and learn, or to one of your support groups, so that the individuals in the support group can ask them questions or talk to them about what they're seeing in regards to their needs around housing or food deserts and things like that? And so all of these are very important in working towards equity. So one of the other tools that we use is the pause model. And what it's asking us is to pause, to literally pause and stop before we act. So the P is pay attention to what's actually happening beneath your judgments and assessments. The A is acknowledging your own thoughts and emotions. The U is understanding your options for possible reactions, for other possible reactions and interpretations. The S is searching for the most important and productive way to handle the situation. And then the E is for examining and enacting your plan. And so example of this would be, say for instance, I have a meeting appointment scheduled with my client, Geneva. And Geneva was supposed to be at the office at 10 o'clock. And it is 10:03 and Geneva is not there. It is 10:30 and Geneva has still not arrived. It is 11 a.m. and Geneva has not arrived. She is not answering my phone calls, and I just feel ghosted. And so the P is to pay attention to what's actually happening beneath my judgments and assessment. What's happening is that I notice myself getting frustrated. I notice myself getting upset. I notice myself not being appreciative of her not showing up and not calling. My A is acknowledging my own thoughts and emotions. So this really makes me upset because I have a large caseload, and every single moment of the day is filled with appointments. And so now if someone misses their appointment, I have to figure out how to reschedule them. Or Geneva's assessment was due for Medicaid or for our funder next week, and I was trying to get it done. And now that really messes me up because I need to get it done to make sure that our organization stays on track. And so I'm upset about that. And in my culture, you're supposed to be on time. If you make an appointment with someone, you're supposed to honor your commitment. And Geneva is not honoring her commitment. So the U is understanding your options for other possible reactions and interpretations. So maybe I'm being too hard on Geneva. Maybe something happened. Maybe her kids didn't get to school on time. Maybe she overslept because she had a late night because she has a young child who is teething, and maybe she was up late. Maybe her phone is going to voicemail, not because she's ghosted me. Maybe the phone battery died. Maybe Geneva's not safe. Maybe someone needs to check on her. Maybe I need to go by her home. And so the S is search for the most empowering and productive way to handle the situation. So I'm going to pull back and I'm going to say, let me think about this. Geneva has always showed up on time for her other appointments. And if she was not going to be on time, she would call. So Geneva does care about her health care, and she does want good outcomes, and she does respect our time together and her appointment. And so I'm going to assume that she is not ghosting me. I'm going to say that something occurred and she just hasn't had time to call me yet. And a little while later, when I take a lunch break, I'm going to swing by her home just to check in on her. And E is to examine it and not act your plan. So when I go on lunch break, I'm going to stop by Geneva's home and check on her just to make sure she's okay. And I will leave her a message because she's given me authorization through a release to leave her messages at her home. So I'm going to leave her a little note saying, hey, missed you today. Just thinking about you. Please call me and let me know you're okay. Let's reschedule. Let's meet up again soon. Whatever that message is. But I'm going to do it through that lens. I'm going to do it through the lens that she's not ghosting me, that she really cares, and that something happened because that's out of her character. Versus just figuring that she ghosted me and she doesn't care, because if I figured that, then I'm going to behave in that way, and that's not healthy. So our action steps, we put this all together, and let's get to work. Let's do the work. So some of the action steps to consider are committing to change and making community engagement a known priority. So if we are talking about engaging with the community and trying to strive towards equity, but only we know it, or it's only something that we talk about at our staff meeting, then there's really no accountability of it. But if we make it public, if we put it on our website, if we say to the staff, this is what we're committed to doing, and we follow up on it, we then hold ourselves accountable to making it happen. Also understand the historical context of previous attempts of engagement with our community. If there was someone who came into the community and came in, asked individuals for their perspectives and feedback and never did anything with it, or they took that perspective and feedback and they applied for a big grant, they got funded, and no one from that community saw them again, that has an impact. And so next person that appears is going to feel the consequences of that. And so you have to understand the historical context. What happened before you were there? What happened with that relationship, with that organization, with that client, or with that family before you, or with that community before you? Also understand the impact of the social and political determinants of health, how mental health is just one segment of someone's life. Physical health, where am I going to sleep tonight? How am I going to pay my bills? How am I going to take care of my children? Do I have clean water? Am I living in a food desert? All of those things combine to create a profile and a holistic perspective and holistic way of behaving among your clients. Immerse yourself in the communities you seek to connect with. And so oftentimes we'll hear people say, I tried and we are unable to get any Black people or Hispanic people in our leadership, or we're unable to find our Black or Hispanic or Asian clients or Indigenous, Native American or Indigenous clients, and we just can't find them. Immerse yourself in the community. Who in the organization looks like those individuals? Who in the organization shares similar culture? When is the next festival or event coming up? Can your organization set up a booth at that event and give out pamphlets that look like those individuals at that event, and engage and answer questions and concerns that they may have? Also practice active listening with the goal of learning versus defending your position. People should be able to come to you and say, I've received services at this organization and it sucks. Or I received services at a similar organization or a different mental health organization, and it did not turn out well. And the people were awful, they were racist, and I didn't get treated well. And we should be able to sit and listen and say, I'm sorry that you had that experience, but I want you to know that that is something we're working on, or we've created some strategies to prevent that, or If you experience that again, please let me know, because that is not okay, versus doubling down and saying, no, we don't do that at this organization. I'm not sure if you went somewhere else or what happened. That's not what happens here. Just listening and listening with intent to learn. Also embrace the opportunities to learn in all interactions with staff, clients, and community members. Every interaction is an opportunity to learn if we listen with open eyes and open heart. Listen with open heart and open eyes, yeah. Also hire and sustain staff who reflect the diversity of the community within all levels of the organization. So again, if we're looking to create equity, our organization should be where the equity starts. We always say charity begins at home. So the equity that you're looking for and the outcomes with your participants and the clients that you're serving, does it even exist within your organization? Or is all of your diversity located at the bottom of your organizational chart and all of the top chart is homogeneous? How are you interacting? What do your community partnerships look like? Also collaborating and engaging and funding diverse multi-sector partners in the work. Who can you collaborate with? If you see that there are a lot of your clients who are struggling financially because they don't have a high school diploma, is there someone in the community that we can partner with that provides that service? And can we fund assessments or tutoring or skills building in that area? Also implementing policies and financial structures that promote accountability. So how are we holding individuals that we fund accountable? How are we holding ourselves accountable? What happens if we don't meet our goals? And then continuously monitoring and evaluating processes, progress, and outcomes for equity. And this is something that is key, because a lot of times we say we want equity and we may implement a few strategies, but we implement it and we walk away. We don't go back and monitor it and see if it's working. And if it's not working, it's necessary that we make change, that we talk, have a conversation, we go back to the drawing board and we make change, and we do it quickly. And because there's power in that pivot. So lastly is accountability. This is extremely important, and it's important to have people around us who are different from us to hold us accountable, and also people that we can go and ask questions to. So I'm working with a family that their culture may be unfamiliar to me, and I have a coworker who identifies with that culture, and I can go to that coworker and have authentic and honest conversations around my perspectives. And are they real, or are they based on cultural conditioning? And how can I better work with this family? And also that coworker that we built that relationship to be able to say, like, you are doing too much, or like, you need to go and sit down. Like, you have to have an honest discussion, and it can't just be one way. It can't just be someone that you found that's different and you only are receptive to what they say when you're in agreement with it. But you have to be able to have someone that say, that's not okay. Like, what you said, that was a microaggression. The way you looked at that family, or you looked surprised when they said this, like, why did you do that? Like, that's important. And so the challenge is to take a look in your cell phone and look at the last 10 contacts, not including your relatives. Are those individuals the same race and ethnicity as you? Are their life experiences similar to yours? Are their priorities the same as yours? And do you share similar fears? And if they're all yeses, that is a big indicator to say we need to create and surround ourselves with more diverse individuals, and start to create an equity buddy, start to find individuals who are different from us and that will hold us accountable, and also that we can have honest and authentic conversations with. That is an important step to not only achieving equity, but holding ourselves accountable to long-term equity as well. And so in closing this, I love this quote by Dr. Kimberly Crenshaw that says, if you see inequality as a them problem or unfortunate other problem, then that is a problem. And so again, this goes back to self-reflection, looking at ourselves, looking in our suitcases and finding those things that may be in there that we are acting and believing and behaving on, and removing them. If they no longer serve us in being the person that we want to be, if they're no longer serving the individuals that we care for in a positive way, it's time to evaluate and remove them. Also, I will share some resources within this slide deck, resources on our 5 things equity leaders want you to know, ways to both foster culturally responsive peer services, and various other resources. Also, with technical assistance and training, these services are offered free through our MHTTC and also our NTAC centers. So I will open it up for questions.
Thank you, Dr. Kanisha. Looks like, yeah, right now we're getting a lot of thank yous, and I think that was a very powerful presentation on what we can do in an individual and how we can build that on a community level too in our workforce, how we interact with each other. So I think that was super helpful. Someone even mentioned that it's nice to see concrete things that we can do within ourselves, and then as we're talking to other people, as we're building a community of equity. So I think that was really amazing. It looks like someone asked if we can reshare the organization links. I think that was the last. Is that the last slide?
Yes. Will they receive a copy of this slide deck?
Yeah, they will.
Okay.
So we can
okay.
send it to them there too.
Okay, awesome. So those slides, those links will be the resource links, and the access to the training and technical assistance slides will be in this document as well.
So I will be sending a follow-up email to everyone with all the slides in PDF form and all the documents and links from all the presentations today. Looks like a question that I got was, how did you get involved in this work?
Great question. I think I started out in working in child welfare, and what I would see in child welfare was that I would go into individuals' homes, and I've received calls from the hotline, go into individuals' homes, and their first thing was like, one person met me in the driveway and like, here's my child, take them. And I'm like, no, I'm not here to take your child. But I would see that would be the behavior of some of my colleagues, that they were happy to take children away, and they would go in and like take a child out of the home, or try to take a child out of the home for like the child was climbing out the window and running away, or they were eating peanut butter and jelly sandwiches. And for me, it's like that's not a win. Like, it's not a win to remove a child from a home, even if you're moving them into a safer condition. We have to be able to try to maintain the family and keep individuals together. And so I would go into those homes with a different perspective of like, how do I maintain this child in this home safely? If they're being abused, like, no doubt, I have to remove them. That's not even a question. But I don't want to be someone going into a home, removing a child because they're eating peanut butter and jelly sandwiches every night. How about I pull back and I understand the story? And so one story that I understood is that this child, that's the only thing that they would eat. And their parents were making sure that they had at least something to eat before they went to bed. Or a child that was jumping out of the window and running away, and the parents took all the furniture out of their room and removed the bed, stripped it down to just the mattress on the floor. And that was because when the bed was on a box frame and a frame, they would jump on the bed and stand on the dresser and jump out the window. And so those things, if you understand the family and the situation, you can better respond. And so that is the way it first caught my attention. And I think after that, and just working with HIV and AIDS and working with individuals, and somehow I would always get the clients who were the most challenging, and people would see me interacting with them and they're like, how did you just make them laugh? Like, that person's just always angry. And it was always a challenge and fun to me to be able to find ways to connect with individuals. Like, if it was a t-shirt that they had on with Kobe Bryant, we could have a conversation about that, or their favorite team. We can have a conversation about the game, or their fears. We can have a conversation about that, and really meeting them where they are. And I think that led me to this perspective of looking at inequities from a different lens, looking at it from a lens of that people were behind in outcomes not because they wanted to, but because we as providers had not engaged with them in a way that was effective and culturally responsive. And so for me, that was fun. And it's a game, and it's like the onus is on me, not on that client. And so that is how I started in this field.
It's amazing. I really like how you looked at the whole picture of like, and then you really found something, just something to build that connection with. And honestly, that's where it really starts. I feel like if we, as we move through our communities, we're walking out in public, we're just so focused in our own lens in our own world. But then when we look up, we might find something in common, might find something to really like, build a bond with someone, and then a really beautiful relationship can be made out of that. So I think that's really wonderful. And I'm seeing a lot of questions coming, which is amazing. That's amazing. They're really interested in getting to know you and your work. And so one of the questions in the Q&A sections, it says, how would you go about implementing more mental health awareness within an organization that does not necessarily have any belief in it? So
yeah, I think it's first, I think we have to get in the mindset, I think, of like not feeling the need to rescue people and not feeling the need to make people change right away. And I call it planting seeds. And sometimes we just have to plant seeds that grow trees. And I think just having those conversations and doing it consistently. And even if it becomes exhausting, doing it consistently and doing it through a lens of love and bringing people in to share their real story, because sometimes it's more effective for someone to come in and share their personal story than for me to tell their story. And so being intentional about people sharing their story and being intentional about keeping our foot on the gas and being consistent and keep bringing this up as an issue, bringing it up and through the lens of love, not through one that requires them to change right away, but one that just plants the seed and walks away. Like, I'm just going to say this and walk away. I'm going to say it tomorrow and I'm going to walk away. I'm going to say it next year and I'm going to walk away. And eventually, through planting those seeds and through continuously having those conversations and bringing people in to share their full authentic story, I think you start to churn the lens of people being more receptive to it. And it takes time. And so that's why I look at it as planting a seed, because we plant seeds and we don't expect the plant to be there tomorrow. Like, it takes time.
I agree. That's actually a really wonderful way of putting it. Planting the seed is just, I've always say it just takes a lot of patience and the persistence. So, but yeah, that's a great way of putting it. Thank you. So there's that one. And then I'm seeing, as a common question that I saw was essentially around like the challenges that you have had in your career, and then, identifying your own assumptions and blind spots and how you overcame those challenges in your career and, within yourself as well.
Absolutely. So I think coming into this as an African-American woman, I had thoughts around it. Like, if you are not concerned with equity, then you don't care about people. Or if you are creating or facilitating microaggressions, then you are racist and you're not a good person. And so over time, I got to learn more about people and pull back and look at it through a different lens, look at it through a lens of love, and that sometimes people do what they do because that's all they know. And if you grow up in a household where in your formative years, racism and things, negative and derogatory things were put into your system by people who say they loved you, and you believe that this information they said was true, that's all you know. And so pulling back and understanding that takes courage for you to be able to change your perspective and change how you feel about certain things when that's your family and your friends or your church is the place that it came from. Like, where do you go to church now? Where do you go to for Thanksgiving or Christmas dinner? And so pulling back and really giving people some grace around that has been really helpful, and still going and planting those seeds and just looking at it through a lens of love and empathy. If that was me and I had grown up in that and privilege for the formative years of my life, and as an adult, these things were reinforced through television, through Facebook groups, through my religion, where would I be now? It's just giving it grace and giving it patience and still being firm that that's not okay. It's not okay, and the behaviors are not okay, and give it grace. And so two things could be true. And I think just looking at it from that lens and also making it fun. How can I meet people where they are and get them to think about things that are harmful in a way that is productive versus one that strikes them and makes them feel like they need to defend and strike back. And so that has been something that has really pulled on my creative and strings, and also forcing me to look at it from a lens of love. How can you force people in a gentle and passionate and assertive way to look at how they show up each day? Who do you say you want to be, and do your actions align with that individual? And if they don't, what are some things you can do? And doing that in a non-judgmental, non-shaming way, and foster an environment where change can really take place and where questions can be asked, and being that person where people can come and ask questions that they would not ask anyone else, and feel safe to do so, because understanding that that's what they know. And it may be really ignorant and it may be really racist, but they come because it's concern to them and they want to hear from you and want to see another perspective. And so that has been really helpful.
It's really amazing. Really, like, I can tell that you're very perspective and really understanding, even if they come from a place that or just don't align with your own thoughts and your own values and morals. So I think that's something that I really took out of that, was that we one of the bigger challenges of building equity even within ourselves is also looking within ourselves and accepting those hard conversations, accepting those, those comments and statements, and instead of thinking of it as like, really taking, like you said, like that pause strategy is amazing, by the way. I would love to somehow share that widely and stuff, but to like really pause and really think, okay, this is where they come from, and not letting it affect you personally, but also being like, okay, well, how can we foster and use these differences to really build and actually communicate and come to a middle ground about something. So I really think that's amazing. So I think we have time for one more question. I think the one that came in earliest was, have you done workshops after your presentation where small groups discuss some of the topics you raised, and how did these go? Do you do any other
Absolutely. Yeah, absolutely. So right now, and that is a link in one of the slides too. If you join the MHTTC mailing list, you will receive information on like upcoming events and training. So right now we are in our second cohort. This is the second cohort that I facilitated of a training called Bold Conversations. And it is an application-based training. And basically we bring people in predominantly in the Pacific Southwest area, but we've opened it up to individuals throughout the country to apply to be able to be in this cohort. And so it's cohort based. We have about 60 to 75 participants, and we bring them in and we talk about these things. And it's a think tank, a peer support group all together where people can come in and just talk about these conversations. We take a lot of look internally, do a lot of self-reflection. We talk about what this looks like at the workplace. We talk about how do you engage in conflict versus trying to resolve it. We do a lot of talk around creating a personal action plan. Now that you've been in this training, what is it that you would like to work on while you're in here still, so we can help you walk through, we can help you with strategies. And it's really been phenomenal. I think people are waiting for it because it's a space that doesn't often happen, where you can just come in and be your full authentic self, regardless of your race, regardless of your experience. And we all come in with the same understanding that we are in different places in our journey, and we're here to look at these issues through a lens of love. And we also going to be respectful of each other at the same time, and make sure that we, in our understanding or in our ignorance, are not further oppressing individuals.
Amazing.
And so that's been very powerful.
Yeah, it sounds powerful. I've been through a lot of cultural responsiveness trainings, and actually implement some of myself too as well. But I always I'm willing to always go to more, because I feel like the more people you talk to, the more experiences and stories you hear, the more you get to like understand that there are different people out there. And oh, okay, this is like, I get really surprised by like some questions people ask, and then I take a step back and I'm just like, oh, okay, I can see why. Because most of the time
Yeah.
they explain, you know, and stuff. So yeah, I really think that that's amazing that you've been doing these trainings. Is there any way that you can share your contact information? Would you be comfortable? I know I'm going to be sharing your
Sure.
last slide as well, but I know there's a few more questions coming in, and fortunately, this is all the time that we have after this amazing workshop. But it is leading into the lunch break, so um, if you all have any other, you know, just thank yous or any other statements, go ahead and put them in the chat. And thank you so much, Dr. Tanisha. You've been just so wonderful, and it's really good to really hear the human side of all of this, because we do talk about advocating on a political, like, you know, policy change level, and like, you know, the socioeconomic level, but it's good to also really be reminded that it starts from the person. So I really appreciate your time with us today.
Awesome. Thank you very much. And thank you again for the opportunity, and to everyone that participated today. Thank you for your responses in the chat and being so interactive and being present during this session today. So thank you all again. And I put my email address in the chat, and you also receive a copy of the slides, so you'll have the resources and information on future training. So thank you again, Ragini.
Thank you. Thank you so much. All right, y'all, that's our morning workshop. So it's time for our lunch break. I'm going to keep the link open and pause the recording. And so go ahead, you can hop off and hop back on. I'm gonna just keep it open because at 11:40 p.m. We will be doing community polling. So technically you can have like a 50-minute lunch this entire, or 45 minutes looks like. Let's call it lunch, and we can convene back for at 12 o'clock for the afternoon workshop. Or if you'd like to join us a little early, just to kind of share your experiences and maybe talk to each other. I saw some amazing conversations happening already in chat. To do the community polling with us, you can also join us at 11:40. So I'll see you all in about 40 minutes or at 12 p.m. Thank you.
So what I have planned today, I'm going to give big picture ideas of the ICCTM core components, sustainability, and action plan development. I'm going to briefly go over the class standards, and then I'm going to show you an adaptation for the ICCTM approach. And then I really want to open it up for questions, comments, and have a little bit of a conversation. And so be prepared. We do have a couple of engagement activities through the workshop, so I'm hoping to get some input as we move forward. All right, so here we go. Ragini, if you can help me with the first polling question. I'm curious, I know this morning Sergio presented on the project, the Solano County ICCTM Innovation Project, and he shared that he's done this a few times. He and Dr. Ton have done this a few times over the years, but how many of you have heard of the Solano County Interdisciplinary Collaboration and Cultural Transformation Model Project before today? So if you could let me know, I would appreciate it.
On Zoom polling y'all, so hopefully you got a little pop-up on your Zoom asking the first question. And also Jill, just to let you know, the second question is already on there as well. How familiar are you with the national class standards?
That's great. We can do both at the same time, so I'll give folks just a minute or so. So for the first one, just yes, maybe you've heard about it, not sure, or no. Just want to get a sense of who's in the audience today. And then since we do have the second one up as well, how familiar are you with the national class standards? And again, class is for culturally and linguistically appropriate services. Are you very familiar, somewhat familiar, or not familiar? All right, Ragini, how are we looking? Can we close that out and share out the results? Oh, thank you, Paul. I see in the chat somewhat familiar. Okay, great. All right, thank you for everybody that participated. So it looks like just over a quarter of you have heard about the ICCTM innovation project with Solano County before. One response is a maybe, and then a number of you have not. Almost 70% had not heard about this project. So that's great. I'll give you an overview, and then we'll dive into some of the details around the action plans. And then as it pertains to the class standards, one person is very familiar. About a third are somewhat familiar, and a good majority are not familiar with the class standard. So it just gives me a good idea of who's in the audience and what I'm going to touch on in my talking points today. So thank you all for participating in that. All right. So this morning, and I'm not sure how many of you were there for Sergio's keynote address this morning, he talked to you about the overarching ICCTM model and really talked about a lot of the details around how the work was done, doing progress updates between couching it in community engagement, class standards, and then showing you some of the outcomes that we've recently reported out on. So just to rephrase this, the first part of our project was really about doing a comprehensive cultural needs assessment. The second component, or the second phase of our project, was creating a customized training that was all around class standards, and that training was very specific to Solano County, really focusing in on the disparities that were identified within Solano County. Also part of that training component is the creation of the quality improvement action plans. I will be diving in a lot deeper in my conversation with you all today around developing those action plans and then building and sustainability of those action plans. And then the third component is implementing the QI action plan. So QI for quality improvement. And if I'm using acronyms that folks don't know, please put it in the chat and I'll try to correct myself as I'm moving forward. So implementing those action plans into the overarching behavioral health system and building in sustainability so we can see that long-term change. So what do I mean by a comprehensive cultural needs assessment? Well, this was something we did on this project that spanned over a couple of years. So this was a really in-depth comprehensive cultural health needs assessment. Sergio mentioned we did lots of key informant interviews with everybody across Solano County, from consumers to physicians to advocates to community-based organization directors and lots of other folks as well. We also held focus groups, and it was really a searching for identifying what the needs and the barriers are within the behavioral health system. And in addition to that, what the recommended solutions would be to address those challenges or those barriers. And then we took that information, synthesized it into the narrative reports that we do have available on our website, and I can provide the links that Ragini can share out with everyone, that basically put all the information together. We put the challenges, put the barriers, put the suggested solutions together, and then we presented those out in a variety of community forums for the priority communities that we were working with in Solano County. And those three priority communities were the Filipino, Latino, and LGBTQ communities. Took all of the information from phase 1 and built the customized training for phase 2. So it was all based on all of the information we had gathered during our community engagement efforts in phase 1. So phase 2, Sergio went over this morning, was 4 different days, 4 hours of training, homework in between, and then 6 months of coaching. So pretty intensive process and experience for those folks who were involved. From there, as a part of the training, the participants were asked to create quality improvement action plans that were based on all of the information that they had just learned in the training. And that again was based on all of the data that was collected in phase 1 around community identified barriers and challenges and suggested solutions. So all of the quality improvement plans, and there were 14 in all for this over 5-year project. All of those 14 were addressing the community identified barriers and challenges and solutions that were also suggested for addressing those challenges. So pretty comprehensive approach. And then once those plans were developed, and that took quite a bit of a process to develop those plans, to really get the vision of the plan, to make sure that it aligned with what the community was suggesting. Once we had that all documented and ready, we shared a transition plan for each of those quality improvement plans with Solano County's Behavioral Health Division, and they then began to implement those projects. And part of implementing those projects within their system is also looking for opportunities for sustainability. So I'm going to leave it at that. And then what I'd like to share with you now is this idea that developing a quality improvement action plan is really a cyclical process. This is something that is critical to the work. So when you're starting it, you can see here, this is a reflection of how we did it within Solano County. There was the needs assessment. Then we had to confirm what the topic areas would be for developing the plans. Then we had to actually draft the plans. From there, once the plans were drafted, there was additional community engagement to make sure that the plans that had been made were reflective of the community's desires for those items. Then from there, the work groups got started. In the Solano project, we did have 6 months of coaching that helped to further develop those plans. And then from there, they were transitioned to Solano County and implemented within the system. So again, just the cyclical process, excuse me, and then community engagement being a very important theme throughout. So making sure that we were constantly referring back, getting community input, putting that input into the plans, and then starting that cycle all over again for implementation. So again, just wanted to really reinforce the need to think of sustainability from the very beginning and not leave it to the end. So one of the things that we did upon starting that implementation process with Solano County is to identify the areas that are already existing in the system that these action plans could live moving forward. So we didn't want to have to create any new systems or new processes that would have to be adopted. We wanted to use what was already in place. And so what you can see here are some of the areas that were identified from the beginning around sustainability. So county contracting practices, that came up. County ended up adding in the class language. So again, the culturally and linguistically appropriate services standards, adding language into their request for proposals and contracts moving forward. There were also policy developments that integrated new language around the culturally and linguistically appropriate services so that that had a house and a policy to then reflect back to. They would also end up extending their interpreter and translation services to all of their contracted CBOs because they wanted to make sure that no matter where somebody went for their mental health services, they were able to receive culturally and linguistically appropriate services. And so adding that feature was a huge feat and a huge benefit to community-based organizations that were providing mental health services within the county. Then you can see we also had diversity and equity plans as well as committees, and that was a really great place for continuous community input. It's a really wide reaching group that attends their committee meetings and a perfect house for all of the quality improvement plans, some a little bit more than others, but all of them living within that mental health plan and that diversity and equity community, or excuse me, committee. And then you can see we had some hiring and retention. They were able to make some adjustments in those processes to make them more culturally and linguistically appropriate. And one of the things, again, just to reiterate, is we were trying to look for things that were already present without having to create new processes, because we knew that was a better chance of having things sustain long term by having that approach. All right, so we already did this question, which is how familiar are you with the national class standards? And as I recall, a number of you are not familiar with them. So let me just say that the class standards are national standards that came out of the Health and Human Services Division, the Office of Minority Health, back in 2000. They came out with 14 standards at that time, but they did revise them in 2013 up to 15 standards. So there are 15 standards. What I have here on the slide for you are the general groupings for each of those standards. So there is an overarching standard called the principal standard that's really encompassing all of the remaining 14 standards into one. Standards 2 through 4 really have a governance, leadership, and workforce focus, and that's really on trying to make all of those layers, so governance, like your board, potentially leadership within an organization, and then the folks who are working within the organization, your workforce, be more reflective of the communities that you're serving. So really trying to be very specific and intentional around recruitment, retention, training, all of that. That's what the governance, leadership, and workforce is all about. Standards 5 through 8 are all around communication and language assistance. So this is around any interpretation that might be needed for appointments, any translation for any materials that the agencies might have, and most importantly, that providing free language assistance is imperative for our health and behavioral health system, and it's a requirement, and not a lot of people know exactly what that means. And I do just want to call out that our health and behavioral health systems are required to also not only let patients know of these services, but they need to do it in the languages that are most prevalent for their communities. So that's going to differ depending on where you are in the state of California. And it also includes posting that information and arranging for services when requested, and also includes sign language. So if that is an accommodation and a communication means for a particular individual, those are all requirements so that everyone has equal opportunity and access to care, whether it's health or behavioral health, and it's free of charge to them. And then the last set of standards, standards 9 through 15, really hit on a lot of different topics. So it goes to the creating culturally and linguistically appropriate goals for your organization, integrating that into your policies and operations, conducting assessments, and we're going to talk a little bit more about assessments as I move forward. Also, really keeping track of your demographic profile for your community or your county, depending on what your local area is. And also making sure that there are different processes to document and track. I know one of the questions that Ragini was asking you just before I got on was around barriers, around cultural and linguistic barriers for folks. And it's actually required that there be a process to identify when those things happen, and then make resolutions that are important and fix the problem, basically. And then ultimately engage with community and explain to the community how it is that you are adapting the class standards into your organization, what plans you have to do that, informing the community of those plans, getting community input on those plans and then doing continual updates. So one of the things I will be providing to Ragini is a handout on the class standards. You can see on the bottom of this slide, we do have a reference to the Think Cultural Health website, which has all of the class standards information on it that I'm sharing with you today, and many, many more resources. So that will also be shared out with you today. All right, so what I'd like to do now is switch talking about the Solano County project and talk about what we can do to adapt creating a quality improvement plan, so it might be something that you all can take on in the work that you're doing. So what I have here is that same cycle, and I did neglect one very important and critical component of these components here that are on the page. So we start out with an assessment, we have a training and developing the action plan, and then we have an implementation of the action plan with sustainability in mind. And in the very center, you'll see there's an orange circle for evaluation. And I also want to give you the same message that I gave you for sustainability. When you're thinking about taking on a quality improvement action plan, make sure that you're also building in the evaluation from the beginning. Don't wait till the end again. Make sure you're thinking sustainability and evaluation from the very, very beginning. So again, this is going to be very specific to your community that you're serving. So you're definitely going to want to do an assessment and figure out who your priority communities are in your particular area. You're not going to necessarily be able to take on a 2-year process to do key informant interviews and focus groups and community forums, but you might have other resources that you already have within your system that you can use to lean on for that needs assessment. And there's also resources, census resources. There may be surveys, annual surveys that are done in your workforce surveys that you might be doing already. There may be lots of different areas that you need to research and figure out what you can do for an assessment, so you can do something much more scaled down than what we presented for the Solano project. Again, the community engagement piece, if you have the opportunity to do key informant interviews or focus groups with folks, or even pull together a community forum, they're great ways to solicit information and confirm that the information that you received really ticks off all the boxes that you're hoping for understanding a particular priority community. Class training is also really important, having a good understanding of those class standards. So making sure that you at least have a general understanding of those 15 standards as you go through the development of the action plans. And then creating those action plans based on the information you collected through the assessment, and then figuring out where sustainability can be built in given your system that you're working within. All right, so this is an adaptation from our phase 1 from the ICCTM project. So we talked about the focus groups, the key informants, the community forums. So really, again, making sure that you're tapping into resources that already exist if you don't have the capacity to do the key informants and focus groups. So a couple of things I wanted to point out today was there is an MHSA stakeholder engagement process that you can participate in, that lots of information is gathered in, a great resource for trying to identify topics that are salient for your community. There are also community assessments that are done from time to time. Hospitals are required to do assessments every 3 years, so that might also be a great resource for you to check out what's available assessment-wise. I did mention surveys. If you do patient surveys, if you do workforce surveys, those can also be great resources. Perhaps you have a quality improvement committee, or maybe a diversity and equity committee, or another committee that you feel like would be a great place to start to help identify what some of those topical areas are. And then really figuring out what are the challenges and barriers that people are experiencing, and what are the proposed solutions. Okay, I'm checking out a chat here. So people from underserved communities, providers, consumers, family members often do not attend or even know about the MHSA advisory committee meetings. Thank you, Stacy. I appreciate you bringing that up, lifting that up. I would say that that is a great place to have your voice heard, and connecting with your local county behavioral health unit. They announce when they're doing these stakeholder engagements. It's usually, I know with Solano, they were done more in the fall, so right about now. So I would highly recommend reaching out and participating in that, and then once they're ready to share out that information, finding their plan to see what those topical areas are. So thank you, Stacy, appreciate that. Other aspects of this phase one. So figure out where your assessment's coming from, identify your challenges and barriers, and propose solutions. And making sure that those proposed solutions are also coming from your community, and checking in with your community to make sure that you've covered all your bases, and then creating some sort of a summary of all of that information. So you have a document that you can put this all down, because eventually you're going to need to start working on these issues, and you're not going to necessarily be able to work on all of the issues that you have identified. So the next phase, which is that training piece and then developing the quality improvement action plan piece, is really, again, using the information you collected in phase one and then integrating it into a process that you're sharing with a work group that you're going to convene. So you're going to need to make sure that you're bringing together individuals within your organization, outside of your organization. Maybe there's a community-based organization or two where you can have some members participating there, but you want to invite a diverse group of folks to participate in this process, to make sure that you're getting diverse perspectives around, yes, we've hit all the barriers and challenges and these proposed solutions, but you know what, we missed somebody. We should also be talking to so-and-so. So again, that cyclical process of community engagement. Once you have the work group convened, you can share that summary report from phase one around those challenges and barriers and proposed solutions. And then you start having conversations on priorities. And some of the things that I want you to think about at that time is, again, you can't hit everything. We can't take on everything at one time. So you're going to have to make some tough choices, and you're going to maybe have a couple of projects that are going to hit higher on the list of priorities. And so I want you to think about the fact that it's okay that you can't do everything at once. There's always time to take it on in another cycle, whether that cycle is 6 months, a year, or whatever time frame it is that you're deciding for that particular project. And then once you decide what those projects are, again, I really want you to think about, okay, how can we sustain this work so we don't just do it and it disappears, but we do it and it's continually worked on year over year. And then also including some sort of way to measure, to evaluate the project, so you can really see change from the time that you start it until the time that you finish. And you can really see those positive impacts that Sergio was sharing earlier this morning that we saw with the Solano Innovations Project. So I do have a handout. This is another document that I'm going to be sharing with Ragini, called an action plan development template. And this is a document that I would suggest that you share out with your work group, that you use to document everything about the topic or topics that you're going to be addressing through your quality improvement plans. It's going to have you thinking about all sorts of different items around, okay, what are our objectives, and how are we going to create these objectives that are measurable and timely, and all of the good SMART goals. So the specific, measurable, actionable, or accountable, and realistic, as well as time bound. So those, creating those objectives, identifying who's going to be the leader, what stakeholders need to be involved, and then really looking at the current reality of the organization you're in, and really trying to determine, are there some organizational priorities that any of these improvement plans could potentially support and get more support because they align with those strategic plans of that community, or excuse me, of that organization. And then there are a few more pages to this template. Again, I'll be sharing it out with Ragini. But the idea here is that the work group has one document where everything is put down. Everybody has access to that document, and then it serves as a placeholder for what's going to be happening next. So what actions you're going to be taking, what tasks you're going to be taking on yourselves as committee members or work group members, who's responsible, what the timeline is, and then moving forward, meeting notes, just very brief meeting notes so that everybody can be on one page. And if somebody misses the meeting, they can go back to this document and find out what was discussed. And then I see, thank you, Ragini. I appreciate you putting that template in there. And then Pat has ethnic specific groups. Yes, some counties do have MHSA ethnic specific groups, and that is wonderful and great resources also for integrating these quality improvement plans. I know Solano County did as well. All right, I do want to leave a little time for questions. I'm going to quickly go through the last phase here of how you might adapt this project or scale it down to make it doable at a local level. So again, I put the same image over here that you're seeing, this cyclical process. We want to remember that this is a cycle, and community engagement is a critical component throughout this project. So whether we're in phase 1, phase 2, or phase 3, we need to engage with community, we need to hear community, we need to document what they have to say and incorporate. It's not just to listen, but to also incorporate that input. So here we have community input. We've got implementing the quality improvement plan or plans, depending on your organization. And then at the end of everything, we're going to make sure that we have our metrics or evaluation metrics that we've chosen that we can show when we started and where we came from. We're also going to have ideas of where we're going to sustain this work within the organization. And the handout that that Ragini just put into the chat has all these different sections in it. So it's going to make you think about all of these different things as you're going along the path. So again, the big hit points are engage with your community, use the class standards as a basis, don't recreate anything, use whatever exists within the system and find the best place for that action plan to live. And please evaluate it so you can see and have the data to say, look, we took on this quality improvement action plan and here's where we started and here's where we've come. And if you continue that work year over year, you can really start to see progress over time. And with that, the last message I'm going to say is sustainability, sustainability, sustainability. So making sure that you're thinking about this. So these are just some ideas to get you thinking. Are there policies that could be adapted? Are there hiring processes that you could adjust? Is there anywhere in the mental health plan or in any committee where this could be living? Are there contracting areas that could be adjusted? And I know contracting can be a little bit challenging. I know that was a barrier that we had in Solano, but we did find ways around it to make small adjustments, and then they have longer term plans, moving forward for contract changes. And then depending on what the plans are, funding can also be a real issue. So it's one thing that I wanted to point out in the report that we did for Solano, in the sustainability chapter, there actually are a number of links that you can tap into and listservs that you can get on so that if your project is in a specific area that's being funded, you can get on the listserv. So when they are putting out applications, you can have that information and apply for that if you need additional funding. So I know we just have a few minutes. I'm going to stop there. I do want to share my contact information. So please feel free to reach out with questions or clarifications. happy to schedule time to connect. And I'm going to be quiet now. So, Ragini, any questions?
No, right now I'm not seeing any questions. I'm actually seeing a really amazing quote that Ali sent in.
I was just reading that as well. Yeah. So Ali wrote, educate and train governance, leadership, and workforce in culturally and linguistically appropriate policies and practices on an ongoing basis. Does this standard also take religious considerations into the action plan? These can absolutely create barriers to treatment and access. And that's a very poignant statement you're making right there. And it does take in all cultural beliefs. So if it is a religious belief that is a part of your culture, 100%. So I will tell you that one of the action plans that was created as a part of the Solano project was all around tapping into local religious units and trying to take mental health workshops for youth into the religious units and work with the ministers, the priests, the rabbis, the clerics, anyone, any of the religious leaders to really start talking about mental health and destigmatizing mental health within their congregation. So 100% it takes religious beliefs, spiritual beliefs into consideration. All right. Any other comments? Otherwise, I would just say, I know it can seem a little bit daunting to take on this type of a project, but the outcomes are 100% worth it. So yes, you need to get a work group convened that has the space and ability to move the project forward. So keep that into consideration. And I've tried to give you some tools to help you really think through this process and how to adapt it in a way that works for your local agencies. So the last thing I'll say is make sure when you're doing this, you have a really critical understanding of the cultural and the language needs of your communities, whether it's at a local level, a county level, or anywhere in between.
Thank you, Jill. I think you highlighted very important aspects on creating the action plan. I've been following the action plan for quite some time and have utilized it in our previous symposium in person, actually, where we did like a very shortened version using the class standards to do like these little breakout sessions that we had before. So it's really and I wanted to bring it back and kind of provide a tool that individuals and their organizations could use to kind of develop an action plan just to meet like a community or meet at least where they're at and meet a goal. And it's very sustainable, and you're right, the outcomes are just fabulous. So
yeah. All right, well, thank you for having me. It's been a pleasure to be here with you. And again, any questions, please don't hesitate to reach out.
Thank you so much, Jill. I really appreciate you.
Thank you.
Thanks. Have a great day. Moving into our next thing, I know we're really quickly going through the day today. It's a very dynamic lineup that we had today. So for what we're gonna do with the next step, and I really hope that everyone is able to hear me because this part is very important. So we're gonna actually move into a Zoom meeting. Right now we're in a Zoom webinar, and we're gonna move into a Zoom meeting, and I'm putting in the link to the Zoom meeting right now in the chat. So if you have access to the chat, just make sure that you're able to see that link. You can easily just click on it. It is our action planning activity of the day. It's a visual recording with Rio Holiday. She is going to kind of guide us through on all the information that we learned today, how we can, as individuals ourselves, how we can provide and what ways we can move forward to building mental health equity just from ourselves. So it's very fun. It's very simple. You get to talk to people. You get to, interact and hear from others. So I think this is going to be the fun part of our day. So please definitely look into the chat so that you are able to hop into the meeting. You can go right now. That's why I essentially had a break, but it's mainly for a transition. So if you're able to click on that link, join that meeting. they will get started and we can get started on the activity. I am announcing to my group, Angela will be waiting there, Rio's there, and a couple other facilitators. We'll be having breakout sessions in that, or like breakout rooms in that, in the activity planning today, and you'll be able to be in small groups, kind of see this beautiful visual idea of like kind of like a pathway. I think you'll really enjoy it. So if you definitely are able to, please go ahead and click on that link in the chat. I will stay on until majority of you have either logged off or moved into the Zoom meeting. And I look forward to seeing you all there. For those of you folks who are still in the room, just a quick reminder, and you want me to, oh yeah, I can definitely put in the activity info again in the chat. Here you go. So just a quick reminder to you all to please go ahead and click on the Zoom link that I just put into the chat box. That will help you get into the actual Zoom meeting where we'll be doing an activity. Unfortunately, on Zoom webinar, we're not able to do activities like that or have breakout sessions where because you're not able to show your face, you're not able to interact as well. So because of that, we're having this specific session of the day. It's the last session of the day. Where we'll be more having an interactive piece where every information that you learned today, you'll be able to apply and kind of just talk to other groups and see if you're able to build a plan for yourself. It's going to be a really fun experience, has a lot of beautiful visual pieces, and it's with Rio Holiday, and she's just amazing. So I highly recommend if you have time to be able to attend that. Again, the link is in the chat box. So yeah, I will see you all there. I'm going to give it another 1 minute and then I will have to close the session and hopefully you're able to grab the link by then. And I'll see you all in the next part of our day. Thank you. Thank you all for being here. Yes. Yeah, let me put in the full link and ID. It's right here, Pat. So the Zoom meeting, the link is right there, and the meeting ID is 838-3285-7875. Passcode is 213458. I just sent it to you, Pat, so hopefully you're able to get that. Of course, no problem. One more time, I am putting in the entire Zoom information, including you can dial in, you know, with your phone if you're not going to be using Zoom, or you can just click on the link. What I'll also do is actually want to make sure you all have the if it's easier, I can also send you just a quick Word doc with the Zoom information so you can download it. Be able to join. If you're not able to copy, sometimes I understand that it's difficult to copy the information from Zoom directly. So I just put in a Word doc, and that Word doc will have just the information that I put in the chat, the Zoom link, and the meeting ID and passcode. So hopefully you're able to open it or download it, and we can quickly hop in. I do have to hop into the activity session, into that Zoom meeting. So I hope to see you all there. I will be ending the session now. Pat, you're welcome to email me if you're still not able to get in, and I'll see if I can get you in, okay? I'm putting in my email right now. All right, well, I hope you have a wonderful rest of your day, and hopefully we get to see you in the activity session right now. All right, bye. Thank you all.